Thank you. Thank you for having us again, and thank you to all the families who are here this afternoon, evening. My name is Raymond Kwong. I'm an advocate with Disability Rights California. With me is Leilani Pfeiffer. She and I will be supporting our presenter today, one of our senior attorneys, Maria Ariate. So, just a quick overview of our agency, Disability Rights California, or DRC. We are a statewide nonprofit agency, and we provide free legal services to people with disabilities with any disability related issues. We have offices statewide with our headquarters in Sacramento. And we have attorneys and advocates who can help with a variety of issues from access or discrimination issue of housing, with transportation, with education, which includes special education and higher education. We can also help with employment, reasonable accommodation issues. We can help with public health benefits, such as Medi-Cal, in-home supportive services, and Social Security overpayment issue that relates to work. And within our agency, we have separate programs, such as our Office of Client Rights Advocacy, or OCRA. They specialize in helping clients of the regional center, and our Client Assistance Program, or CAP. They specialize in helping clients of the Department of Rehabilitation. So if you'd like to make a private appointment, speak with one of our advocates on your specific issue, our phone number is in the chat. It's 800-776-5746. Our phone lines are open Mondays, Tuesdays, Thursdays, and Fridays from 9 a.m. to 3 p.m. If you call us outside of those hours, you can leave us a message and our advocates will get back in touch with you. So without further ado, I'm going to let our presenter begin. Thank you.
Thank you. So Raymond's going to put up two PowerPoints, one in English and one in Spanish, and you will get everything that we show you today. So today we're going to talk about a program called California Children's Services. We refer to it as CCS. Next slide. And I'll let you read here. So this is just a presentation, not providing any legal advice. The information that's in this PowerPoint is, excuse me, but it could change in the future. So if you're using this in the future, just, excuse me, make sure that you, make sure that everything's up to date. You can always call us. Excuse me, something happened here. So we're going to learn about what is CCS, the eligibility criteria for CCS. And within the world of CCS, there's something called the Whole Child Model Program that I'm going to discuss. I'm going to talk about services, how you apply, what happens when you have CCS and other insurance. So for example, private health insurance or Medi-Cal, and the appeal process. So let's go on to the next slide. So CCS is a program for persons below the age of 21 who have certain physical disabling conditions. And we're gonna look at the regulations that talk about the different conditions that makes someone eligible for CCS. It is a California program. So for example, if you move out of California, you'd have to figure out what the state you move to, what kinds of programs they have that are similar to CCS, if any. The majority of persons, and I say persons because not only are they kids, but also young adults, have both Medi-Cal and CCS. I think over 80% of persons who have CCS have Medi-Cal. And so when that happens, when someone has both Medi-Cal and CCS, Medi-Cal reimburses CCS for their care. And of those who have Medi-Cal, a lot of them are in Medi-Cal managed care plans. So there are two service delivery models with Medi-Cal. There's the fee-for-service delivery of service model, where if you have fee-for-service Medi-Cal, you can go to any doctor who takes Medi-Cal. and is a Medi-Cal provider. The other way is through a Medi-Cal managed care plan. And this is if you want to know more about CCS, you can go to this website through this link. Next slide. Okay. So CCS is administered jointly by county health departments and the California Department of Healthcare Services. CCS is administered by the Integrated Systems of Care Division within DHCS. So you've got county health departments and Integrated Systems of Care Division within Department of Healthcare Services. In whole child model counties, and I'm going to talk about that in a moment, CCS is administered by the Medi-Cal Managed Care Plan. In other words, if you live in a whole child model county, your Medi-Cal Managed Care Plan is administering your CCS. It's all under the Medi-Cal Managed Care umbrella. We'll talk about that a little later. I'm going to go through some things that may be a little confusing, but I think they're important for you to know as background for CCS. So let's go on to the next slide. This is really important. So CCS authorizes medical services, rehab, equipment, etc., for CCS eligible conditions only. And they have to be medically necessary. So let me explain that with a case. I had a parent who reached out to me whose daughter at the time had CCS. The daughter is a person with cerebral palsy and other disabilities. And the mother had been trying to get durable medical equipment from CCS, like a Hoyer lift to be able to move the daughter from like bed onto the wheelchair, perhaps, and other durable medical equipment. And so CCS kept denying the requests, and the mom didn't understand why CCS was denying the request. And so when I spoke with mom, I asked her, well, what is the condition that made your daughter eligible for CCS? And she says, I don't know. So I ended up calling the case manager for her daughter at CCS, who's a nurse case manager. And she explained that the condition that made her daughter eligible for CCS was a heart condition, and that the durable medical equipment that the mom was asking for had nothing to do with the heart condition, and therefore they were denying all that durable medical equipment, and that if mom wanted that durable medical equipment, she should go to Medi-Cal. So once I explained this to mom went to Medi-Cal to get the durable medical equipment. So it's really important to understand what condition made the person eligible for CCS, because that's the only condition that CCS will treat. If the person has other conditions that did not make them eligible for CCS, they're not going to get any services or supports for those other conditions. You're going to have to look to other health insurance, maybe private insurance or Medi-Cal for that. CCS also provides therapies at schools through the medical therapy units. I'll talk a little bit about that a little later. So the goal of the CCS program is to provide medical services to kids for kids who qualify for these services. Next slide. Okay. This is probably a little too much information, but it's here, so I'll explain it. Sometimes you'll hear that that this CCS county is an independent county, or the CCS county that you live in is a dependent county. What it all means is that for independent counties, it's counties where populations are greater than 200,000 people, and CCS programs within the county, so their CCS offices within the county, are responsible for making eligibility determinations, authorizing services, managing the case for your CCS eligible kids. If you live in a dependent county, it means that the population in your county is less than 200,000. And in that case, there are regional offices in LA, San Francisco, and Sacramento that determine eligibility, approve services, manage your cases. So the difference between independent and dependent is that in independent counties, there will be local office, a CCS office. If you're in a dependent county, you would go to your nearest regional office. Next slide. Okay. So follow me if you can when I talk about carved in and carved out. This is also something that you might hear. Okay. So the Medi-Cal managed care plans, where the Medi-Cal managed care plan is responsible for authorizing and coordinating both CCS services and Medi-Cal services. It could be a whole child model county. Those are considered to be counties where CCS is carved in. You know, it's part of the Medi-Cal managed care plan's obligation. If CCS services are carved out, it means that CCS is responsible for authorizing services and other things. Typically, this is where the person is on Medi-Cal fee for service. Sometimes there may be a Medi-Cal managed care plan that's not in the whole child model county where services are carved out. I know it's confusing, but carved in just means that the Medi-Cal managed care plan is responsible for authorizing and coordinating both CCS and Medi-Cal. If you hear it's carved out, it'll be CCS that's responsible for that. Next slide. Okay, let's talk about the whole child model program because I've been referring to it, but I think it's time to explain it. So beginning in July of 2018, CCS eligible children who lived in certain counties where there were Medi-Cal managed care plans, the Medi-Cal managed care plan became responsible for authorizing services, processing claims, payments, and oversight of quality. So what are currently, what counties have the whole child model program? So in the next slide, you're going to see, next slide, please. The counties that currently are whole child model counties. So if you're in any of these counties, like CenCal Health is a Medi-Cal managed care plan in San Luis Obispo, Santa Barbara, Health Plan of San Mateo, Cal Optima in Orange County, Partnership Health Plan in these counties like Del Norte, Humboldt, Napa, etc. If you live in these counties, then your Medi-Cal managed care plan is participating in the whole child model program, and your Medi-Cal managed care plan is both responsible for CCS and for authorizing services, claims, etc., not eligibility, both CCS and Medi-Cal. So if your county, if you live in any of these counties, then your child is in CCS, your child is, the Medi-Cal managed care plan is participating in the whole child model program. So everything regarding CCS, not everything, not eligibility, but services, claims, etc., are all through the Medi-Cal managed care plan. Next slide. Starting in 2025, January, there are other counties that are going to become whole child model counties where the Medi-Cal will take over CCS and, of course, the Medi-Cal. So Butte County, Colusa, Glenn, Mariposa, Nevada, Placer, Pluma, San Benito, Sierra, Sutter, Tehama, I don't know if I'm pronouncing it right, and Yuba. So if you're in any of these counties, you'll probably be getting letters indicating that this is what's going to happen. The CCS will now be, your Medi-Cal managed care plan will now on January 1st of 2025 will now be responsible for authorizing CCS services. So there's been, I've been doing this for over 20 years, and I've seen a move to this kind of model for CCS. It started with fewer counties. Now we have more counties, and in 2025, we'll even have more counties where this is happening. And why? Because there's a thought that if you have both CCS and Medi-Cal under one roof, there's better care coordination. Next slide. So even if you're in a whole child model county, CCS makes all CCS eligibility determinations, period, end of story. Okay. And for CCS to approve the person has to meet the income test, the medical test, and the resident test. So let's look at those tests. Next slide. Okay, the income test, it says that in order for the child to qualify for CCS, the family's adjusted gross income has to be $40,000 or less per year. And CCS will look at your California income tax return. Now, if your adjusted gross income is more than $40,000, it's possible that the child may still qualify if the cost of the child's care for 1 year will be more than 20% of the family's adjusted gross income. Now, if at the time that a child is adopted, the child was already eligible for CCS, then the adopted parent's income will not matter. And when they're looking at family income, it includes the income from the child and the natural or adoptive parents. It doesn't count the income of other family members or a step parent who has not adopted the child. So that's the income test. Next slide. Okay. Remember I mentioned these medical therapy units at school? Well, if your child is getting physical therapy, occupational therapy, or other therapies at school through the medical therapy unit, CCS will waive the financial eligibility standards. So if that's all your child is getting, you don't have to meet the prior test I just mentioned. That's not important. Now you have to make sure that the services that are being covered by CCS are included in your child's IEP. Next slide. Okay, what's the medical test? So the child has to have a physical disability or illness that is serious and severe. It includes disabilities that are, infectious diseases, diseases of the nervous system, eye, circulatory system. And we're going to go ahead and open up this link. The link will take us to the regulations, and you'll see a list of qualifying disabilities. I'm not going to open them, but if you're curious about whether your child or someone would meet the medical eligibility test, then you would go to this link, and then where you see the blue, you could actually click on the link and it'll open up. And so we just opened up infectious diseases. So this is California Code of Regulations, Title 22, Section 41515.2. And this describes what it means to have an infectious disease, what you need to show in order to meet the medical test. And let's go back to the other page. So as we scroll down, we see there's something here, mental disorders and mental retardation. What that's going to tell you is that if the only thing you have is a mental disorder, it's not going to qualify you for CCS because it is not a physical condition. If the only thing that you have is mental retardation, that's not going to qualify you for CCS. But if you have one or the one or both of these, but you have a physical condition that would qualify you for CCS, then that would be okay. But if it's just mental disorder or mental retardation or both of these, and that's it, you're not going to be eligible for CCS. So we're going to go back to the presentation. Sorry, it takes a moment because Raymond has to bring those up. So you'll see here it says mental health disabilities or mental retardation. It's an old term, sorry about that, alone do not meet the CCS medical eligibility test. So that's the eligibility medical test. So next slide. Well, someone's saying that the link isn't working. It should, because we opened up the link that we used the link from the PowerPoint. You might want to try it again. The residency test. So we've talked about income test, medical test, and now residency test. You have to be a California resident because this is a California program, and residency of the child is determined by the residency of the parent. Undocumented parents can be California residents. To be a California resident, you just have to have the intent to remain indefinitely in California. That's all. So that's easy to establish a lot of times. So next slide. Now, once you are qualified for CCS, there's an annual enrollment fee. So most families have to pay $20 each year, but you don't have to pay that $20 if you meet any of these conditions. Your child has full scope Medi-Cal with no share of cost. Your child gets therapy through school, through the MTU unit. Your family income is less than 100% of the federal poverty level, or your child is in the optional targeted low-income children's program. Next slide. On top of the $20 annual fee, most families are expected to pay a sliding fee based on family size and income. They don't count any income again for income from child support to brothers or sisters, or the income of the step parent who hasn't adopted the child. They will look at the child's income and the parent's income. So there is this sliding scale fee. Slide. So question, do you have to pay the sliding scale enrollment fee? Not if you meet any of these conditions, and they're pretty similar to the other conditions for the $20, except here the family income can be less than 200% of the federal poverty level, but the other conditions are the same as when you don't have to pay the $20. Slide. Okay, services. So CCS will approve services that are medically necessary. CCS is health insurance, right, for certain people. And so every health insurance plan, whether it be a private plan, public plan like Medi-Cal, CCS, other health insurance, you can't just request something and expect to get it. At a minimum, you have to show that what you're requesting is medically necessary. And every health insurance, whether it be public or private, has their own definition of what is medically necessary. And so CCS has adopted the Medi-Cal medical necessity standard for children and young adults below the age of 21, which is CCS will authorize services if the services will correct, ameliorate, or maintain a CCS eligible condition. If you want to know more about this, you can go to the link. So you have to show that services are medically necessary with CCS or with any health insurance. Next slide. What kinds of services can you get through CCS? Doctor visits, hospital services, rehab, medications, supplies, durable medical equipment, communication devices, medical transportation, in-home nursing services. It's for the condition that made you eligible for CCS only, okay? If it's not for the CCS condition that made you eligible, you've got to look to other insurance. So I'll tell you a little story here. I had a mom who reached out to me and she was trying to get, again, she had her son's Medi-Cal doctor fill out a prescription for some services. She submitted the Medi-Cal doctor's prescription to CCS and said, here, my son needs this. But CCS kept on denying, and she wasn't understanding why CCS was denying these the requests. And so I had to call CCS, and what they explained was that, and next slide, please. What they explained is that they are not going to approve any services from doctors who are not CCS panel doctors. So this Medi-Cal provider who was not a CCS panel doctor who wrote this prescription, it was useless to CCS because that's not the way they approve services. And I'll talk about CCS panel doctors in a moment. But it's really important to know that it's for services that support the CCS eligible condition that are going to be provided by CCS paneled doctors, health providers. CCS also provides case management, that involves trying to coordinate the services and supports that the child is going to need, and maybe referrals to other agencies for further support. So it's a really important function that CCS provides. Next slide. And the wonderful thing about CCS is that they have these specialty care centers. Medi-Cal doesn't have anything like this. So these specialty care centers provide comprehensive coordinated care to CCS clients with specific medical conditions. So at these specialty care centers, there are teams of doctors, social workers, therapists, nutritionists, a whole team that's devoted to the child, a whole team that evaluates the child and the whatever, and coordinates the services and supports that the child will need. And those conditions include the ones that are listed here. There's a link here that talks more about these specialty care centers and the conditions that will qualify a child or young adult to go to a specialty care center. So what happens if a child has been receiving these services through a specialty care center and this now young adult turns 21, you lose CCS when you turn 21. You no longer have CCS. And so they've been used to all of this comprehensive care, wonderful care, and suddenly they're 21 and now they only have perhaps Medi-Cal, and Medi-Cal doesn't offer something like this. And it's a really, it's a loss, right? Because they've been used to all of this wonderful care, and suddenly now someone's got to help coordinate all of this care, and you're having doctors and other health professionals who may not be, communicating with one another. So this is something very special that CCS has. Next slide. So who provides CCS medical services? It will be a panel of doctors who've been approved to be panel doctors, CCS panel doctors. Remember the example of the lady who gave CCS a prescription for things from the Medi-Cal provider? Well, that Medi-Cal provider was not a CCS panel doctor. And so if the child has CCS and doesn't have a panel doctor, you can find one. There's a link here for a list of CCS panel doctors and providers. The list also includes I think it includes the specialty care centers. So you've got to get the services from a CCS paneled health provider. Next slide. Does CCS have to approve services? Yes, you have to get approval of services before the child gets the treatment. So unless there's prior authorization, CCS won't pay for the service. However, CCS may pay for a service retroactively if the services needed to be provided while a CCS office was closed and you notified the CCS office the next day it opens. That I'm really talking about emergency situations. So it's possible under that scenario, but otherwise you need to get prior approval. Next slide. The medical therapy program, I've been talking about it. These medical therapy units are located in public schools. They provide physical therapy, occupational, and other therapies to children with certain neurological and musculoskeletal disorders. So for example, children with spina bifida or osteogenesis imperfecta, cerebral palsy, etc. And again, you don't have to meet the income requirement to get services at the MTU. Next slide. Okay. If your child has Medi-Cal and has CCS and you don't want to go to the MTU, you could go directly to Medi-Cal and get the therapies. Okay. Even if your child is in the Whole Child Model Program, CCS is responsible for processing any referrals to the MTU unit, not the Medi-Cal managed care plans. So even if the managed care plan is carved in or it's in a Whole Child Model Medi-Cal managed care plan, CCS will always be responsible for eligibility determinations and processing referrals to the MTU. There's more information on the link here. Next slide. Are there services that CCS will not pay for? Yeah, some of these are obvious, right? When it was not authorized or the authorization expired. You didn't use a CCS approved provider. It wasn't a covered service. Well, you'll know if it's covered or not if you got prior authorization, but if you went out there and got the service, first, there was no prior authorization. And secondly, it could be that it wasn't even a service that was covered by CCS. This is an obvious one. If your child is no longer eligible for CCS, you can't go to CCS and get reimbursed. If the parent didn't follow the treatment plan or keep scheduled appointments, if the service is not for an approved CCS eligible condition, if the parent hasn't paid the required CCS fees, if the medical treatment was completed, let's say that it was approved for a certain number of sessions and that's it, it's completed. And also the service your child needs is fully covered by another health insurance plan, which is not Medi-Cal or Healthy Families, because if the child has private insurance and CCS, CCS is payer of last resort, right? So you would have to go to the private insurance and try to get the service from them before CCS would. If your child has private insurance, CCS, and Medi-Cal, then you have to go to private insurance first, then go through CCS, and CCS if will approve or not. If not, it might be Medi-Cal that's responsible for the service. Next slide. To apply for CCS, you can go to this link and it'll tell you where to apply. At either you're going to apply at the local CCS office because you live in an independent county, or you're going to apply at one of the regional offices because you live in a dependent county. Next slide. I've talked about other health insurance. So yes, you know, CCS, at the time of that you apply for CCS, they will ask you, and when you're reviewed annually, whether you have other health insurance. And you have to give that information because, like I said, CCS will be payer of last resort if you have other private health insurance. Next slide. So CCS will pay if your health plan will not cover the services or pays for only part of the bill. But just note that CCS will pay the CCS rate. That is, it'll pay the difference between what the health plan paid and what CCS would have paid if it were paying all the bill. So that's important to know. Next slide. So if your child has Medi-Cal and CCS, how does that work? So if your child is in a Medi-Cal managed care plan where CCS is carved out, or your child is in fee-for-service, CCS will act as your medical case manager. CCS doctors and nurses will decide what treatment your child needs and will help arrange it. If the treatment is something that Medi-Cal covers, then Medi-Cal pays for the treatment, but approvals come from CCS. And if CCS decides that your child needs services that Medi-Cal will not cover, then CCS will pay for them directly if the services are medically necessary for the CCS eligible condition. There's a lot here. You'll have time to go over it, but if your child is in a whole child model program where your Medi-Cal managed care plan, where CCS is carved in, then the plan has case management responsibilities, right? You're going to go to that Medi-Cal managed care plan to get CCS services, etc. Next slide. Okay, appeals. What if you don't agree with something, a decision denying your child a service? Who you can appeal, yes, most of the time. Who you appeal to, the process to follow, and the timeline for appealing depends on whether you're in a whole child model county or whether you're not, and whether it involves CCS eligibility. If you are in a whole child model program county and you want to appeal, remember, this Medi-Cal managed care plan is taken over your CCS. So it's all under one roof. Your CCS and your Medi-Cal is under one roof. And so if you're not happy with the CCS decision from your Medi-Cal managed care plan about services, then you are going to follow the Medi-Cal managed care plan's appeals process. And that appeals process is outlined in this link. It's a link to a publication about Medi-Cal managed care plan appeals and grievances. Very important to understand that. Next slide. Is there anything you cannot appeal? Yes. If your child's CCS doctor, the doctor who's responsible for supervising your child's care, that would be the CCS primary care doctor, orders, reduces, or terminates the service, and you disagree, the only option you're going to have is to choose from a list of 3 expert doctors, and that expert doctor that you choose will review the case and make a decision, and that decision will be final. So when I used to get CCS cases, because I don't do casework anymore, but when I did, and there was one of the things I would want to know is who made this decision to reduce, terminate a service, because if it was the CCS primary care physician, then It can't be appealed. And so you only have the choice of having another doctor review and make a final decision. Next slide. Okay, CCS and Medi-Cal appeals. Anytime a Medi-Cal service is denied, reduced, or terminated, you get a notice of action. Anytime a CCS service is denied, terminated, or reduced, a notice of action must be sent, except for what I just said in the prior slide, okay? And the notice of action will explain the reasons for the decision, cite authority, meaning the law, regulations, guidances, etc., for the decision, and importantly, tell you what the appeals process is. Next slide. Next slide, please. Okay. All Medi-Cal and CCS hearings are held, are through the State Hearings Division, and that State Hearings Division is located within the California Department of Social Services. The State Hearings Division also hears Medi-Cal appeals, IHSS appeals, and other types of appeals. It's not Office of Administrative Hearings. They hear regional center appeals and special ed appeals and many, many other types of hearings. So when you have a child who has CCS and Medi-Cal, you have the option of filing the first level appeal with CCS, could be county CCS or the regional office, or you just file an appeal with a Medi-Cal appeal. You have the choice of appealing through CCS or through Medi-Cal. How do you appeal? You submit a hearing request online. You can create an account with State Fair Hearings, what's called an ACMS account. And you will have access to your file at State Fair Hearings. You can look to see what documents have been submitted are in your file from CCS perhaps. You can download your documents into your file. It's just an electronic way of managing your case. You don't have to do it. You don't have to do it at all, but next slide. And you can mail in your appeal to that address. You can call State Hearings Division. When I appeal state cases that involve are within the jurisdiction of State Fair Hearings, I just call an appeal. And usually they'll give you a case number right away. And there you go. It's that easy. And I want to get a case number because that's my proof that I appealed on time, right? So different ways to appeal. Now, next slide. Remember, in whole child model counties, you're going to use the Medi-Cal managed care appeals process. Remember that. But if you are if you only have CCS, or you have CCS where, and you have Medi-Cal where CCS is carved out, you're going to go through the CCS appeals process. So you're going to start with the first level of appeal, and we're going to go to the next slide. I'm not going to go through it. I spend a lot of time going through it, and you just come out of this training with pretty confused because there's a lot of procedure. But the first level of appeal with county CCS, you've got to appeal within 30 days. With Medi-Cal, you have 90 days to appeal. So you can see right away that the appeals timeline for CCS, where you have to file with CCS, is a lot shorter. There are 2 links to 2 publications that go further in detail about the whole CCS appeals process. Next slide. Aid paid pending, what is that? So it allows you to continue with the service or maybe even eligibility until there's a hearing decision. So if service is terminated or reduced, with Medi-Cal, you have the right to continue the services until there's a hearing decision, but you have to appeal before the effective date of the change or within 10 days of the notice, if you're not notified at least 10 days before the change, and ask for aid paid pending. You would make that request for aid paid pending when you appeal. Next slide. For aid paid pending, when we're talking about CCS appeals, currently based on a decision called NL, people who are doing CCS appeals have 120 days from the notice of action to appeal. So this flexibility, because they're giving you more time than normal, will end July 1st of 2025. And the notice that you receive from CCS should tell you this. They tell you the timeline that you have to appeal. However, we say don't wait to appeal until the last moment, because while you're not appealing, you're not getting the service, right? So unless because you haven't even requested aid paid pending. So do it as soon as possible and appeal. Why wait? They give you a lot of time, but why would you wait? Because you want to resolve the issue as soon as possible. Next slide. Okay, this is a new process. It's called CCS grievances. It's not for service denials or reductions or denial of eligibility. Okay, because those are the subjects for appeals. You might want to file a grievance against CCS, maybe lack of coordination of your child's care, poor customer service, perhaps discrimination against you and your child. Maybe there's been your child's health information has been provided to people when it shouldn't have. The quality of care, you're not happy with referrals to services. So there is a process for that. And your grievance will be resolved. It should be resolved within 30 days. Calendar days of the time that you file it. If your grievance involves serious threat to harm, severe pain, potential loss of life, limb, or major bodily function, they are resolved within 3 days. I say that if it's serious, you need to get medical care right away. I mean, waiting 3 days for a decision may be not a good thing. And you can file those grievances directly with county CCS or the regional office if you are in a dependent county. Next slide. Resources. So we've included some resources. CCS appeals, numbered letters. These are letters that are sent out with regard to CCS counties and from the main CCS office within DHCS about things that CCS counties and regional office should know about. The grievance and appeals fact sheet, more about CCS, CDSS, State Fair Hearings Division. NHELP is a national organization that does a lot of work, obviously, with healthcare. And there's a really great publication about how to access durable medical equipment through CCS, because that seems to be a difficult thing to do sometimes. So there's more information there. And next slide. So we've come to the end of the presentation. I'm happy to take questions, comments.